Hello, everyone, and welcome to the Herbal Knowledge Keepers. This is episode 17 with Dakota Granny Woman and myself, Blue Star Deer Woman. And today we're going to begin a series about Lyme solutions. And so if you have any questions and or any feedback, you can always go to the Herbal Knowledge Keepers Facebook group and tune in with the conversations that are happening around all the topics that we bring to you in these episodes. So, hello, dear Dakota.
Hello there. We're going to plunge into some of the ways to treat Lyme disease, even though I would like to cover a lot more in preparation for this about the co-infections and all of that, but I decided, since there are probably a lot of viewers who are struggling with Lyme right now, to throw out a lifeline to y'all and give you some inspiration about your healing. And so we're going to go ahead and start with treatments. At some point we'll backtrack to get into the co-infections and more about the elaborate testing and all that kind of thing. But for now, I think that it's time to give you some Lyme solutions. I'm going to open up the herbal database and
And for our new viewers and new audience, this show is based upon the herbal database. And if you go back to episode 1, episode 2, you will see that Dakota and I are introducing how to use this. So just to let you know, you'll always see this, whatever theme or topic that Dakota's bringing to the table here, we will demonstrate it in the herbal database.
Okay, so when you go to the database and open it, this is always the opening screen. And using the search box, I'm going to now look up Lyme treatment. We'll go to the overview section. All right, so you see here under treatment, we have a lot to look at here. This information panel can be raised by clicking that upward pointing arrow. We're off to the races. Now, here are a number of videos and websites that talk about treatment in general, but I would like to just plunge in right here about the treatment controversy. This is where we have a lot of problems because there's a difference of opinion in the medical community about Lyme. We see that the CDC recognizes that Lyme is a clinical diagnosis. A previous show covered what a clinical diagnosis is. They feel that the longest treatment necessary is 30 days of doxycycline. And so the IDS, that's the Infectious Disease Society of America, has a similar viewpoint about it, and they recommend a Lyme IFA screen and only a Western blot if the IFA is positive. In the testing area of the website, you can find out what all of those terms mean. They also say that the maximum length of treatment is 30 days of doxycycline. So when we hear comments like antibiotics don't work, it generally reflects this approach, using only doxycycline for 30 days. After that 30 days is over, as far as they're concerned, they have cured Lyme, and any residual effects are treated with painkillers, maybe ADD medicine, psychological help, that sort of thing. So they basically don't believe there's such a thing as chronic Lyme. However, there are the Lyme specialists who over the last 20, 30 years have developed practices treating thousands and thousands of patients in league with research laboratories who really have a much more thorough understanding of this condition. They say there is chronic Lyme, and because the testing is inadequate, and because Lyme is the great imitator and can masquerade as ALS, that's Lou Gehrig's disease, or multiple sclerosis, or 380 other diseases, that it's important to keep treating Lyme. There's another organization called the International Lyme and Infectious Disease Society. Those are the guys that are, I would say, much more progressive and detailed in their understanding of Lyme. They're the ones that provide a Lyme educational program for physicians that qualifies them as Lyme literate doctors. Those are the guys who are giving us the best physicians who are Lyme literate. So they have a completely different idea about what this disease is and different protocols that fall within it. A lot of them are using primarily antibiotics, and those treatments do work, but it's not 30 days of doxycycline. They're using protocols that cycle different types of antibiotics according to the different forms and growth cycle of Borrelia. They have days off where there are no antibiotics, and perhaps an antifungal is given. And they have an extensive support program revolving around lifestyle, diet, exercise, herbs, different things like that, to make a more well-rounded approach. So in those programs, we have, for example, Lyme specialists like Dr. Horowitz, who was the vice president of ILAD, and he's been using everything he can get his hands on and has had 10,000 success stories. Although I will say, and I'll get into this later when we get into the Cowden protocol, there was a time where he had 500 patients who were not receptive to anything he was doing, and so he called Dr. Cowden, who uses an energetic herbal protocol, for help, and brought in some of the recommendations from Cowden, and those 500 people, most of them recovered. By the way, one of the big things that Cowden found was those guys were not drinking enough water. Here we get into more details to kind of step you through a treatment overview so you can understand why it's so difficult to treat, what the immune effects are. I think I mentioned previously that there are a number of doctors who don't look at this so much as an infection as dysregulation of the immune system, because Borrelia, as a stealth organism, has all kinds of tricks up its sleeve to alter the immune system in such a way that it becomes invisible. And that alteration allows a lot of other bacteria, protozoa, viruses to come to life and take over the body. And here are survival strategies that Borrelia has up its sleeve. And we get into treatment duration. So there's a lot of information for you here. Burrascano is also one of the Lyme specialists. So is McDonald. These guys have a lot to offer. They do use antibiotic therapies, and those therapies work a lot of the time. However, I will say that I'm not a big fan of antibiotics. That's heroic medicine. And while it may resolve these Lyme symptoms, it's not ever going to fully get rid of Lyme or the Borrelia. In fact, nothing seems to get rid of it entirely. We'll get into that later. The main thing you want is a return to health. And it can do that to a great extent, but there may be some serious damage to the microbiome from these antibiotics. They do use probiotics and things like that. We'll get into that in more detail later, I think. So I just want to go through some of your options here once you get to the Lyme treatment overview and start looking through that. One of the big issues is brain fog. As you'll recall, we talked previously about how Borrelia spirochetes head straight for the central nervous system. And a lot of folks are dealing with brain fog. We see here there are two different kinds. The first is that feeling of fogginess in the head, and the second is a problem with the actual function where there's confusion, attention span isn't so great, can't find the right word, and there's a description here of what is behind this and some of the things that you can do directly to help fix that side of it. But this is symptom treatment. What is important to understand is that for a thorough recovery from Lyme or virtually any other infectious disease especially, is we follow something called the therapeutic order. Think of it as like a pyramid, and the base of the pyramid is where we use something we call restorative method. We restore the body's overall health, the metabolism, the body chemistry, the function of the organs with techniques like proper diet, all the things you've heard of, exercise, sleep, all of that is required in order to actually recover. And that's really the starting place for treating Lyme. Although when it's acute, you do have to go to symptoms and treat some of those. We only go to the heroic when it's an acute situation. And so let's go back to treatment overview. Here we have different herbs used for treating Lyme. And if you look at this, it's important to learn about these herbs and what they're doing. They're not all equal. They have different functions. A lot of folks have been excited about stevia because of some news that came out that stevia is more effective than antibiotics in killing Borrelia. What isn't well understood about that is that those studies were done in vitro, in other words, outside of the body in a petri dish, and there was direct contact between the stevia and the Borrelia, and it killed it. That doesn't mean it's going to do the same thing in the body, mainly because stevia is not systemic. It's not going to travel all throughout the body and get into all the tissues and hiding places and kill Borrelia. Although of interest, now ordinarily I would have left it out because of that. However, I've noticed that Dr. Horowitz includes stevia in his protocol. He has a deep understanding of all of the different kinds of research, and for him to include it means he may know something about it that the rest of us don't know. So I'm going ahead and putting it in there with the caveat that this is not a way to kill Lyme when it's systemic in the body. In other words, an in vivo study would be required to prove that.
So Dakota, can you speak to, and I'm sure it's probably if we click on any one of these, right? Like I'm looking at Shazandra, and I know you've done a class on that before. Can you just give like a one pointer of what each particular herbs address? Like, not overall Lyme, but a particular part of the body?
Well, I'll do a few of them because I really want to move on to some other things.
Okay.
And we can come back to this as we go through, but I will point out a few. So, for example, Andrographis. In the Buhner protocol, which I'll show you, he considers Andrographis to be the most important herb for treating Lyme. So he's saying that if you only have one, use Andrographis. Here we have, in fact, here is a quote from his book, and I'll just read it. Andrographis is perhaps the best primary herb to use in the treatment of Lyme disease. It's anti-spirochetal, that's the type of bacteria. It enhances immune function, protects the heart muscle. It's anti-inflammatory, helping with the arthritic symptoms, crosses the blood-brain barrier, where it's active both as an anti-spirochetal and calming agent, enhances liver function and protects the liver, which is very important, by the way, if you're doing antibiotics. If you'll recall, antibiotics are very toxic to the liver. And it helps clear infection from the body because it's shown significant protective effects against inflammation-mediated neurodegeneration in the brain. It's essential to use in Lyme disease. It easily crosses the blood-brain barrier and accumulates in significant quantities in central nervous system tissues as the brain, spinal cord, and cerebral spinal fluid. It can also be taken as a bitter 20 minutes before a meal. It's very bitter. And the bitter principle is used in herbalism to improve digestion. So improving our ability to take in nutrients is just another part of the puzzle. So that's andrographis. We have very powerful herbs that are being brought into treatment by Lyme specialists who were previously just all about the antibiotics. Teasel is also well known. What Teasel does, one of the things, now the thing about herbs is they're multimodal. They do a lot of different things without generally being toxic to the body. Teasel is one of the stronger herbs, so you want to be careful with it. Take it in low doses. And here's information about Teasel. You can click on these links and read more about it. What it does in terms of Lyme disease is it doesn't cure it outright by any means, but it helps to keep the actual spirochete in circulation as the spirochetal or L form, so that other antibiotic herbs or the immune system can find it and get rid of it. So that's how the Teasel is working.
Okay, when you say keeps it in motion or movement, otherwise what's it do?
I think we covered this in a previous video, but the Borrelia has 3 different forms. It has an active form, which is the screw-shaped or spiral-shaped living bacteria that looks kind of like a spiral-shaped worm that's traveling around the body. And then it has an L form that it takes when it's getting ready to divide and possibly form the 3rd form, which are these cysts. So one of its survival techniques is when the immune system is caught on to it and is killing it, or there are antibiotics, and this can be antibiotic drugs, the synthetic antibiotics, or it can be antibiotic herbs. When it knows those are around, it turns into the cyst form and it loses the outer cell wall, which is what antibiotics and the immune system uses, a kind of like a homing device to find it and kill it. So now it's become invisible to the body in a way. And those cyst forms are dormant. They can be in virtually any part of the body. So they're just sitting around waiting for an opportunity to change back into the spirochete. And the spirochete is really what is generating a lot of the damage. Some of these are adaptogens. So for example, the ashwagandha, when we're dealing with the foundational level, we want to have something that is working as a broad spectrum type of a tonic that's ideally bidirectional, that's giving support, active support to these tissues and organs that may be underperforming as a result of the disease. So tonic herbs are used for that purpose. This is just one of them. There are others. This one's going to be probably more effective for adrenal support if the adrenals are being affected, which they probably are because Borrelia upsets everything. I mean, not Borrelia. I'm making up words now. The Borrelia. One of the important things about using these adaptogenic tonic herbs in view of the therapeutic order and the foundation that has to be laid, the Chinese were the real pros on proper use of tonic herbs. And they admonished us not to use them unless we had the foundation well in order. In other words, people had a good diet. they were sleeping, they were exercising, they had the basics that are needed. Because if you don't have the basics, if you're on the standard American diet and think you can take an adaptogen or a tonic to fix everything, you're actually at risk of having it backfire on you, because it needs the different nutrients and that a good diet and proper breathing and the metabolism changes that are required during sleep in order to do their job. So it's not a replacement for lifestyle changes. Okay, let's go back up here. Talk about the Herxhiemer reaction for a minute. This is something that if you are having a die-off of any of these bacteria, for now we're talking about Lyme, there are toxins that are spilling out of their little dead bodies that are causing a reaction in the body of really severe symptoms. That's called the Herxhiemer reaction. And until all that toxic waste material is cleaned out of the body, you're going to feel sick. And some people don't really complete their Lyme protocols, whichever one they're on, because the Herxheimer is so awful. It can last for days and people just feel awful. One of the good things about it is it's a sign that there's a die-off. You can do things about it, and if you're using your herbs and your whatever protocol you're on properly, they're designed to minimize this Herxheimer reaction. If you don't know what you're doing or your doctor doesn't know, then you're at risk of this increase of symptoms. And I'm always adding to the database, right? So there's probably going to be more that I'm going to add to this. But for now, one of the natural products, this herbal product, berber, which is part of the Cowden protocol, reduces very quickly the Herxheimer reaction, and you take this every 10 minutes or 15 minutes. In fact, here's 8 to 10 drops in half a cup of water every 15 minutes. Some say 10, but we'll just go with 15.
So and I would imagine it.
You know it. When a Herx hits you, you know it. It's like you've been feeling sick or not so great, and then all of a sudden you feel significantly worse, really headachy. You can read about the Herxheimer here. This is specifically in Lyme. In the database, there's other information about Herx. Here's information about what's going on, when to expect stronger Herxheimers, and this is in the chronic form of Lyme, how to manage the Herx. There are different ways to manage it.
So would like similar protocol to cleansing after you do a parasite cleanse and then you follow it up with getting the dead bodies out of you. Would that be a similar cleanse as this?
No. The Herx, what you do for the Herx is more immediate. The parasite cleanses that are a little bit more longer term. This is definitely just to quickly bring down the Herx itself. And so in some cases what they do is just say stop your treatment for a period of time to let it subside.
Got it.
In some cases, in fact, what you may do is stop your treatment for a day or two and just do berber. Okay?
So treatment could be at that point a potent antibiotic?
It could be anything, even the herbal treatments. When we say antibiotic, let's clarify, we have antibiotic herbs,
right,
and we have antibiotic drugs. And they both are aimed at killing the Borrelia, and they both can, if they are actually killing it, they can result, if there's too much of a rapid die-off of a lot of it, they result in the Herx. So the good news is that you are killing it. The bad news is that you might wish that you weren't around anymore either.
Right.